Afternoon, it's time for In the Trenches. Today I'm going to talk about nephritic syndrome. Yesterday I talked about nephrotic syndrome. Nephritic syndrome and nephrotic syndrome are not the same thing, they're different entities. With nephritic syndrome, you see hematuria, either gross or microscopic, and you see red blood cell casts in the urine. And the hematuria is not of glomerular origin. So you see sheared red cells, they're dysmorphic, and they could look like Mickey Mouse heads. It's the classic teaching. They also have proteinuria, but it's non-nephrotic. It's non-nephrotic range proteinuria. Okay, and they have hypertension because of fluid retention. So that's nephritic syndrome. The problem with this, it could develop into rapid progressive glomerulonephritis, and person can lose their kidneys and wind up on dialysis. This is a serious thing. So when you make this diagnosis, you want to look at the causes. And you can basically put this in 3 boxes. Immune complex, anti-GBM, and quasi-immune. These are 3 categories, and you would diagnose this via biopsy. You'd have to get a kidney biopsy. Now, immune complex, okay, the causes are post-infectious. The classic teaching one is strep. You can see this with endocarditis or a renal shunt nephritis, shunt infection. You can see this with lupus. Membranoproliferative, which also causes nephrotic syndrome, could cause this. And you can see this with IgA nephropathy. And this could be with the upper respiratory tract infection. The infection here is sympharyngitic. Any GBM often involves the lungs also. We have bleeding into the lungs, and when it involves the lungs, it is called good pastures syndrome. If not, it's any GBM nephritis. But here, you have bleeding, hemorrhage into the lungs. It's one of the pulmonary renal syndromes. And the quasi-immune diseases are the ANCA-related diseases. GPA, granulomatous polyangiitis, MPA, microscopic polyangiitis, and sometimes you can see it with eosinophilic granulomatosis with polyangiitis, not as common. This is how you approach this. So what you're going to do for post-infectious, okay, you know, you're going to treat the infection of endocarditis. To diagnose this, you get complement levels. And complement levels will be low. Post-infection, normally you have a decreased C3. Lupus, you have decreased C3 and C4. Membranoproliferative decreased C3 or C4, because the other thing that causes is cryoglobulinemia, and classically here you have a decreased C4. Post-infectious, sometimes you can see decreased C3, but usually you could make these diagnoses. You get complement levels, and you see whether the total hemolytic complement, the C3 or the C4, are reduced. With membranoproliferative, you could see this with Hep C, and you could also see it with lupus. And lupus usually have decreased C3 and C4. Here you'd order an anti-GBM antibody. I've never seen a case of this in my career, and these could also be associated with the ANCA diseases. The ANCA diseases, you're either going to get a C-ANCA, which is the Proteus 3, P-ANCA, okay, which is the myeloperoxidase. C-ANCA is more common with GPA. And here often, in addition to the kidneys, you have the lungs and the upper airways involved. Okay, microscopic polyangiitis, its cousin. This just involves the kidneys and the lungs. You don't have upper airways involvement, and you don't have granulomas or nodules in the lungs like you can see with GPA. And EGPA is different flavors, but it's classically an eosinophilic vasculitis, and it's associated with asthma. So how do you approach somebody who presents with nephritic syndrome? You're going to get complement levels on them, an ANA, a hepatitis C antibody, any GBM antibodies, and ANCA levels. Based on the results of that, you'll determine if they need a kidney biopsy, and based on the results, you'll determine the treatment. The ANCA diseases we see, this is something GPA and MPA you will see. Lupus does this. You're going to see that. You will see the post-infectious sometimes. And that's all I really have to say about nephritic syndrome. Let's shut it off.